Anine, bonjour. Hello, my name is Lois Brown. I am the nurse educator at the American Indian Cancer Foundation. I want to welcome each of you to today's webinar titled Abnormal Mammogram Results, Now What? This webinar will be about 15 minutes long and is intended to provide a brief overview of potential abnormal mammogram results. Due to the short duration of the webinar and to respect your time, there is no time allotted for me to respond to questions live. However, if you do have questions, I encourage you to type them into the chat box if you are watching with us on Zoom. You can open the chat box by clicking the chat icon on the bottom of the Zoom screen. If you are watching on Facebook, you can post a comment if you are watching with us live or if you are watching the replay. You can also send an email to health@acaf.org, that's health@aicaf.org, and we will send a follow-up email answering the questions and provide a recording of the webinar. I would like to thank the team members from the Clinic and Community Health and the Urban Cancer Solutions Program at ACAF for helping create the content that I will be going over today. For those who registered and attend today's webinar, you will be entered into a drawing for our Indigenous Pink Contigo Thermos. The winner will be announced tomorrow via email and Facebook. After today's webinar, you will receive an evaluation in your email inbox from Robert Spencer, who is a ACAF evaluation coordinator. The link is also conveniently located in the chat box if you're watching with us on Zoom. This evaluation will only take about 2 minutes of your time to complete, and if you do complete it by the end of the day, you will have a bonus entry into this giveaway. So let's start off today's webinar with a poll question. You should all see a box on your screen with the poll question. If you could take a moment to answer it and hit submit. The poll question reads, did you attend last week's webinar, What to Expect at Your Mammogram? Just waiting for a few results. Okay, so I'm sorry, due to technical difficulties, the polling is not showing up for us. I really apologize. We'll just move on with our webinar today. So what is a mammogram? Let's briefly review this. A mammogram is an X-ray of the breast, and the mammogram is used to detect and evaluate any changes in the breast. Who should get a mammogram? Well, the first thing you should be aware of is that there are variations to national mammogram recommendations. The guidelines that are presented today are general guidelines. I encourage you to talk to your doctor to determine what is best for you based on family history, your health, and any past or current breast concerns. Females of all ages benefit from an annual Well Women exam. There is a recorded webinar that can be found on ACAF's YouTube channel and Facebook page where Dr. Briegel, who is a gynecologic oncologist, provided valuable information on what you can expect in these exams in her presentation titled, Demystifying the Well Woman Exam, What Are You Doing Down There? The clinical breast exam can be done every 1 to 3 years in women ages 40 and younger, and for every year for women who are older than 40. For mammograms in general, women can start getting regular mammograms at the age of 40. You always want to make sure you work with your doctor and insurance company to ensure the cost of your mammogram is covered. You can also talk with your clinic about available programs to cover the cost of your mammogram if you are under or uninsured. Did you know there are different types of mammograms? There are screening mammograms, diagnostic mammograms, and surveillance mammograms. Let's briefly review what these 3 types of mammograms are. The screening mammogram is for women who have no signs or symptoms of breast cancer. Approximately 2 views of the breast tissue is obtained, and the radiologist does not need to be on site to read the images. Therefore, results of the mammogram are sent to the primary care doctor or the referring doctor, who will provide the results to you at a later date. The diagnostic mammogram is for women with a breast concern, such as a lump or nipple discharge. It's also for those who have a suspicious area found on the screening mammogram. It is the same procedure as the screening mammogram. However, additional images from different views of the breast are taken. Results of the diagnostic mammogram are known during the visit as a radiologist is on hand to read the images and determine if further testing is needed. The diagnostic mammogram may reveal 1 of 3 things. 1, that an area on the screening mammogram that appeared suspicious is actually normal. in which case that woman would return to regular mammogram schedule. Or it may reveal that an area of suspicious tissue is probably not cancer, but we're not certain that it is normal, so the woman may be asked to return in 4 to 6 months to rescreen. Or the diagnostic mammogram may suggest further testing is needed. The surveillance mammogram is a regularly scheduled mammogram that occurs following a breast cancer diagnosis. So only women with a previous diagnosis of breast cancer would experience this type of mammogram. Typically, the surveillance mammogram is scheduled on a regular basis for 5 years following breast cancer diagnosis. Similar to the diagnostic mammogram, the radiologist is on site to view images to determine if more images or further testing is needed. If there is one thing to take away from today's webinar, it is this: not all abnormal results mean cancer. More information is needed. So what else could an abnormal mammogram result mean? Well, there are several reasons that a mammogram may come back as abnormal. It could be as simple as an unclear image, so it is labeled abnormal and the woman is called to return for a diagnostic mammogram where clear images will be obtained as well as additional views of the breast. There could be changes in the new images compared to older images, so more images are needed to take a better look at these changes. It could be a fluid-filled sac called a cyst, which is never cancer, or it could be a fibroadenoma, which is a lump found in the breast, but it is non-cancerous. None of these abnormal results are cancerous, but it is still very important to rule out cancer by following up as your provider recommends. If the results of the further testing show it is cancerous, there are different stages of cancer, and as you can see in this infographic, the earlier it is found, the easier it is to treat, the better the outcome will be. It is much better to have regular mammogram screenings and find breast cancer in the earlier stages before it spreads to other areas of the body. Breast cancer is the most common cancer diagnosed in women. It is the second leading cause of cancer death for American Indian Alaska Native women. American Indian Alaska Native women experience a 10% higher death rate with breast cancer, and this could be due to several reasons. A couple reasons could be not getting screened because of access to mammograms, or it could be women choosing not to get a mammogram due to fear of the unknown. While the fear of the unknown is understandable, it is important to know that there's almost 100% survival rate if caught early. Get your mammogram. If it is abnormal, follow through with the recommended follow-up because breast cancer is treatable and very good survival rates if caught in the early stages. In stage 0, there's 100% survival rate. Stage 1, 98% survival rate. Stage 2, an 88% survival rate. In stage 3, there's a 52% survival rate. And in stage 4, where the cancer spread beyond the immediate region of the breast, there's a 16% survival rate. This is a great visual that helps put this into perspective. If 1,000 women have a screening mammogram, about 950 of those women will have normal results, leaving 50 women to be called back for further testing due to suspicious findings. And 6 of those women will be diagnosed with breast cancer. More often than not, the additional procedures listed here are normal, meaning the abnormality or suspicious area found on the screening mammogram is not cancer. I cannot stress enough how crucial it is to follow through with these next steps to rule out cancer or to find cancer in its earliest stages so treatment can begin as soon as possible. We already briefly discussed the diagnostic mammogram earlier. If the diagnostic mammogram reveals abnormality, the doctor may recommend these other follow-up tests in order to try and learn more about what is going on. If you are asked to return for a breast ultrasound, a gel is placed on the breast and a technician gently moves a wand over the breast tissue to produce images, looking more closely for abnormalities such as lumps and cysts. This is quick and not usually uncomfortable. The breast MRI is where an X-ray uses a magnet, radio waves, and a computer to produce a picture of the breast in order to evaluate the abnormality. The woman will lay on a movable exam table with her face down, breasts hanging freely into cushioned openings, and the technician moves the woman into the MRI machine to get the pictures. The woman will lie very still during this procedure. It is not painful. If the test results for the breast ultrasound and the breast MRI are normal, the radiologist will recommend when the woman should schedule the next mammogram appointment. The doctor may determine that a breast biopsy is needed. There is a non-surgical and a surgical biopsy. In a non-surgical breast biopsy, a very fine needle is guided into the lump to take a sample of the abnormality. In a surgical breast biopsy, the area of the breast is numbed and an incision is made to remove part or all of the suspicious area. It will take approximately 3 to 5 days to get results, and most results will be conveyed via phone or you may be called into the clinic for a visit. If results are not cancerous, the doctor who performed the biopsy will provide instruction as to when to go in for your next mammogram. It's important to know that you are in charge of your health care. The medical staff want you to know and understand what is going on every step of the way. You have the right to ask questions and to ask those questions repeatedly until you understand. You are not expected to be an expert in this area. Your medical team welcomes any and all of your questions. And if you don't understand, keep asking questions until you do. So again, if you have any questions, please use the chat box in Zoom or, and we'd love to get back to you, or you can contact us on health.acap.org. Remember, those who registered and attend today's webinar will be entered into a drawing for our Indigenous Pink Contigo Thermos. And we will announce that winner tomorrow via email or Facebook. And again, please, if you could just take 2 minutes to fill out our evaluation, which again is in a link is posted in the chat box. And you will get an email from Robert Spencer following the webinar. The information that you give us will be very helpful for future webinars. And you will be entered into a bonus entry into this giveaway. Okay, so it sounds like our polling is working. So you will see a poll box, and if you could answer the question, that would be wonderful. How are you celebrating Indigenous Pink Day on October 18th? And you can go ahead and feel free to check all that apply. And I'll just give you a few moments here to respond. Great. It looks like many of you will be wearing your pink to raise awareness on October 18th. Thank you so much. Have a great day.